Do you think you guys may have obstructive sleep apnea? In this short video, I'm going to dedicate this to the risk factors. Stay tuned. I'm going to tell you all the risk factors for obstructive sleep apnea. If you guys haven't subscribed to the channel, please hit subscribe on the bottom right and hit notifications so you can get all the latest updates on all our newest CPAP videos. If you haven't subscribed to CPAP Nation on Facebook, I provided the link below as well. It's a private chat forum with sleep apnea sufferers such as myself, giving advice and help through everything we've been through to help you guys along the way. Let's get right into it. Anyone can develop obstructive sleep apnea. Number one risk factor is being overweight. Most but not all people with obstructive sleep apnea are overweight. Fat around the upper airway while sleeping can cause obstructive sleep apnea. Medical conditions that are associated with being overweight, such as hypothyroidism, also can cause obstructive sleep apnea. Not everyone with obstructive sleep apnea is overweight and vice versa. I have seen people here as thin as a rail have severe obstructive sleep apnea, and I've seen athletes as well have obstructive sleep apnea. Number two, narrowed airway. You may inherit a narrow airway or have enlarged tonsils or adenoids, which can block your airway, leading to obstructive sleep apnea. Number three, having a large neck. Women who have a neck circumference larger than 16 inches and men having a neck circumference larger than 17 inches are at higher risk of obstructive sleep apnea. Number four, having high blood pressure puts you at higher risk of developing obstructive sleep apnea. Number five, chronic nasal congestion. Obstructive sleep apnea occurs twice as much with people who consistently have nasal congestion at night, no matter what the cause is coming from. This may be attributed to narrow airways. Number six, smoking. People who smoke are more likely to develop or have obstructive sleep apnea. Number seven, having diabetes. Obstructive sleep apnea may be more common in people with type 1 and type 2 diabetes. Number eight, gender. Being a man makes you twice as likely to have obstructive sleep apnea versus being a woman. And a Harvard article cites that 4% of all middle-aged men have obstructive sleep apnea. Number nine, postmenopausal women. Number 10, a family history of sleep apnea. If you have family members with obstructive sleep apnea, higher risk of having it. Number 11, asthma. Research has found an association between asthma and the risk of obstructive sleep apnea. Number 12, certain drugs such as muscle relaxers and narcotics as well as alcohol can relax the upper airways, putting you at much higher risk of having obstructive sleep apnea. There is such thing as having obstructive sleep apnea while only on those substances and none while off. On a final note, if you go in for a sleep study and you believe you have obstructive sleep apnea, make sure you do your exact bedtime ritual before taking the test so it's as accurate as possible. For example, if you drink a glass of wine in the evening, make sure you follow that same ritual unless otherwise told by your primary care doctor. Hey, thank you guys. I hope this helps you guys. Remember to subscribe and to join CPAP Nation on Facebook. God bless and sleep well.